the plateau phase is brought to you by an inward calcium current. That inward calcium current is useful for the heart because, unlike skeletal muscle, the heart relies more on extracellular calcium to activate the contractile elements inside the cell. Remember, skeletal muscle releases calcium ions from storage sites inside the cell to trigger the interaction between the thin and the thick filaments. The heart muscle relies primarily on extracellular calcium entering during the action potential to trigger the interaction of the thin and the thick filaments. In fact, that's the basis for some of the drugs used to treat high blood pressure, calcium channel blockers. They block the inward current of calcium in the muscle cells of the heart and thereby weaken the contraction of the heart to help lower blood pressure. Diltiazem, cardizem. The drug that made Ewing Kauffman rich so he could buy the royals is a calcium channel blocker. Long since generic. Back when he was. We can monitor the electrical activity of the heart from the surface of the body. In fact, the heart is like the WDF tower across the street over here. If we had a radio or a TV over here, we could pick up the signal being sent from that tower. And likewise, if we attached electrodes to the surface of the body, we could pick up the signal being sent out by the heart as a result of the action potential passing through the heart. From the SA node through the atrial wall into the AV node, the bundle of His, the bundle branches, to the apex, into the Purkinje fibers, and on into the ventricular myocardium. The resulting tracing we call an electrocardiogram. It's like a telegram from the heart. You use a telegraph to send a telegram. Well, you can use an instrument called an electrocardiograph to record the electrical activity of the heart, the tracing of which is called an electrocardiogram, abbreviated either ECG or EKG. Actually, it was developed by a German-speaking individual, and in German they spell cardio with a K, so it's EKG there. We spell cardio with a C here, so we usually say ECG. Obviously, either one refers to the same thing. The electrical cardiogram then allows us to see the electrical activity of the heart at the surface of the body. And if you take an electrocardiogram, this is a normal reading. This is a series of action potentials occurring throughout the heart. This is one cycle of the heart. This is the second cycle of the heart. Here's the third cycle. Here's the fourth cycle, fourth, fifth, and sixth, and so on. Here we've enlarged one cycle of the heart, showing you the normal deflections picked up by an electrocardiograph and the tracing we call an electrocardiogram. Notice there are three major deflections found in a normal electrocardiogram. The first deflection is called the P wave. The P wave corresponds to the action potential passing through the atria. The P wave is the depolarization of the atria. The P wave is the signal for the atria to contract. The P wave is the electrical signal telling the atria, contract. The atria contract and they push a little extra blood into the ventricles. Well, blood's going into the ventricles anyway, but when the atria contract, it gives a little extra push so a little extra blood can go into the ventricles. It's important if you're exercising. If you're just sitting in class napping, it's not a big deal. Next, we have this huge deflection called the QRS complex. The action potential now has arrived in the ventricles, and the ventricles are much larger than the atria, and the result is a much larger deflection. The QRS complex is the depolarization of the ventricles. The QRS complex is the signal for the ventricular myocardium to contract. It says, ventricles contract. This is then followed by the T wave. The T wave is the repolarization of the ventricles. Remember, in the action potential, you have two phases. You have the depolarization phase and the repolarization phase. It's kind of like dominoes. You have a row of dominoes, you knock them over, that's a lot of fun. You want to do it again, but to do it again, you have to set them back up. Knocking them over is a depolarization phase, setting them up is repolarization. The QRS complex depolarizes the ventricles, the T wave repolarizes it. QRS complex essentially is sodium, calcium entering the cells. The T wave is potassium leaving the cells. So what's missing?
The atrial polarization.
Yeah. So it doesn't happen? No. Well, it never happens. You don't set up the dominoes, the game's over. Don't play again. Exactly, it happens during the QRS complex, and because the ventricles are so much more massive than the H wave, it's obliterated by the QRS. Now, I mentioned earlier that the AV node can speed up or slow down the rate of conduction of the action potential from the atrium to the ventricles. And we can view the effects of changing resistance of the action potential through the AV node by what's called the PR interval. From the start of the P to the start of the Q, the PR interval. If we raise the speed bumps in the AV node, the PR interval gets longer and heart rate decreases. If we lower the speed bumps of the AV node, the PR interval gets shorter and the heart rate increases. So in doing electrocardiogram, they can detect normal activity of the heart. They can also detect abnormal electrical activity. That may reflect, for example, an SA node not functioning, heart that's being driven by an AV node, and even detect damage done to the heart as a result, say, of a heart. When the ventricles contract, they eject blood into vessels called arteries. By definition, arteries conduct blood away from the heart. Veins conduct blood back to the heart. Notice the vessels that are shown here. Some are in red, some are in blue. What does red mean? High in oxygen. Blue means in? All right. So the arteries are what?
Most of the arteries are oxygenated.
Pardon?
Most of the arteries are oxygenated.
Most of them. What arteries are?
The pulmonary.
Oh, okay. So red doesn't mean artery. Red means high in oxygen. Notice that in the systemic circuit, the circuit being fed by the left ventricle, the arteries are shown in red. Because the blood being pumped out of the left ventricle is blood that's just returned from the lungs where it's been oxygenated. So in the systemic circuit, the arteries are shown in red because the blood is high in oxygen. The veins are shown blue because the oxygen content has been removed or reduced as the blood passes through the systemic organs. In the pulmonary circuit, however, notice that the pulmonary arteries are in blue because we're pumping blood low in oxygen to the lungs, where it's going to be oxygenated. Blood then that returns to the heart via the pulmonary veins is shown in red because it's been oxygenated. So the colors are reversed in the pulmonary and systemic circuits. In the systemic circuit, the arteries are red, the veins are shown in blue. And in the pulmonary circuit, the arteries are blue, the veins are shown red. You're beating, your heart beating, and she's checking her heart rate. She's worried. I think I'm different. The rhythm meters. So what color is blood in reality? It's red, no matter where you take it. I mean, it's not trying to tell you the color of the blood. The blood's red whether you take it from a systemic vein or a systemic artery, pulmonary vein or pulmonary artery. Although it may not be quite the same color red if it's oxygenated. Usually oxygenated blood is a brighter red than deoxygenated blood. But usually when they take blood from you, they take it from a systemic vein and the blood comes out. It came out green, the phlebotomist would probably pass out, right? Call 911 or something. Well, the vessels that receive the blood from the ventricles conduct blood away from the heart towards the organs are called arteries, which literally means air duct. It sounds kind of strange, but actually in ancient times they thought that the arteries